Welcome back to the Thom Hartmann Program. I'm Alex Lawson, filling in for Tom, and I have the distinct pleasure and honor of being joined in studio by my friend Michael Lighty, the Executive Director of National Nurses.
Oh, we shouldn't say that. Director of Public Policy.
Director of Public Policy. I even looked to make sure, but the Director of Public Policy of National Nurses United. And, you know, I always say, if the nurses aren't involved, I don't want to be there because y'all are really just at the forefront of so much. Also, whenever there's a protest or anything, it's way more fun when the nurses are there because y'all know how to take a moment, build a movement, and push for change. So I'm interested in what you're in town for right now. What are the nurses doing in D.C.?
Well, we've got a couple hundred nurses, Alex, who are running around Capitol Hill lobbying senators on Medicare for All. When Senator Sanders introduces his bill, we want co-sponsors on that bill. We believe that if you're a Democrat, you should support Medicare for All, period. And then we're also on the House side where we're lobbying for John Conyers' H.R. 676, which has 108 co-sponsors, a majority of the Democratic caucus. So they're getting the message over there in the People's House that this is a bottom line issue, especially for Democrats, but more broadly than that, independents and Republicans increasingly. And then we're also lobbying on a bill that we did in California to great success where we limit the number of patients each nurse takes care of. And that has major impacts on the quality of care in hospitals. And so those are our two priorities. We're also working on VA collective bargaining rights, pushing back on their privatization schemes, and making sure that nurses have adequate protections when they are handling patients, when they lift them, and so forth. So we get some of the technical nurse issues. And, of course, there's always the Robin Hood tax, which we fundamentally need so that Wall Street funds human needs, not just their own greed. So
yes. I get made fun of a lot by these guys because they say that, like in Blues Brothers, when the band says, oh, we play all types of music, country and Western. They say I'm like that with Social Security and Medicare.
Oh, right.
But you know what? When I talk about it, the phone lines light up because people do care about this, and I'm only getting gentle ribbing from them. But I spend a lot of time talking about Medicare and talking about the failures of the for-profit health industry. That actually that the root cause of the problems is the for-profit aspect of it. Right. That is, as long as that's left there, you'll only have shades of terrible, right? It's like if you leave them totally unfettered, they will just let people die for profit. That's it. But you could then regulate them, and then you're like, well, you can't let everyone die for profit, and they'll just let some people, right? Like until you fundamentally excise that whole thing and get to healthcare as a right for everyone in this country, we will be left with these stories. And, you know, the callers call in, and I mean, you know, this across this country, people have these horror stories of just what happens in our current non-system, where because it's not a healthcare delivery system. Nurses have to fight against a system in order to deliver care too often. Because the system is set up to make money.
That's right. That's right. And it's fundamentally the difference between an industry model and a caregiving model. And we, of course, the nurses come from a caregiving perspective. And you're absolutely right. The industry model says we're going to enhance revenues. And the notion that there's competition is actually not true because each industry player benefits from the current system because as the revenues go up, they all make a bigger profit. So, yeah, so pharma will charge more. The insurance companies are willing to pay it because their premiums go up. Their percentage of profit goes up, and the hospitals will pay it too because they can just build on a charge on top of what the drug companies are. So the notion that they're in competition is actually false. Pharma is basically a dividend machine for Wall Street. The insurance companies have antitrust protections, and the hospitals are encouraged to consolidate in order to gain market leverage. That's a system where prices rise, costs go up, consumers, patients, in our view, pay more, and workers are shafted by their employers shifting the cost to them. And it's all driven by that exact revenue model. Even the nonprofits act like for-profit.
Right.
So that's the insidiousness of it. It almost doesn't matter in our nurses' perspective whether they work for a for-profit or a nonprofit because they treat them the same. Now, it's true you can see studies where the for-profit providers actually have worse outcomes. But you can also see that this profit system is pervasive. and it prevents nurses from practicing as they were educated to do. And precisely on your point about the delivery changes, because they don't do Medicare for all, because they don't finance it publicly and save money by putting everyone in the one risk pool, eliminating the profits and executive salaries of the insurers, limiting what pharma can gouge us, right, and lower those prescription drug prices. They don't do any of that. So guess what? They turn to the nurses and say, hey, we want you to get this patient out of the hospital. Right. We want you to, practice according to this guideline, regardless of whether it's in the best interest of the patient.
Right.
All those delivery changes are driven by the fact they didn't save money on the finance side.
So I have a theme that I talk about because resisting Trump, opposing Trump is so important, and we will, and we're going to just keep doing that. But we actually only lose when we forget what we're fighting for. Right. And I will admit I fought for Obamacare because I wanted to expand Medicaid. That's definitely the best part of Obamacare. Expanding Medicaid helps real people. People's lives are improved by it. I also, though, and I was talking with Richard R.J. Eskow, and I admitted that the thing that I bought or the mistake that I made, I didn't believe that Democrats would actually ever be like, oh, well, this is the end. This is what now we got it.
Right.
I was like, no, obviously not. But this is a step towards single payer. And I want to expand Medicaid. I want to expand Medicare. I want to create one system, get rid of the different tiers, and eliminate the private industry. And of course, the Democrats have fought for generations. Their North Star was Medicare for everybody, right? I mean,
you were younger then, right, Alex?
I was. But it really did shock me in a way because I heard it like, no, we're not going to, single payer is not possible. And I was like, right. What are you talking about? What are you aiming at then? Right. If you don't have the North Star of healthcare as a right, if that's not what you're walking towards, like, where are you walking?
That's right.
You allow the insurance companies, big hospital, big insurance, big pharma are driving the bus. Unless you're aimed at healthcare as a right.
That's right.
And so I will tell you that I will never again be fooled into thinking that it is obvious that these steps towards Medicare for everybody are obvious steps for everyone. So I go out of my way. And there has to be an understanding that what we're fighting for is a fundamental, a radical restructuring of healthcare in this country, not the industry, not right. And if I can take a moment because it's fun, it comes up often. They're like, well, what about the insurance industry? What about all? And I'm like, I'm not that worried about them. Right. We have plans to do, we will figure out some things to do. But in point of fact, get rid of them.
That's right. Well, they're all administrators. The growth in healthcare jobs has been administration jobs. Right? And the insurers are the worst force in the market because they're the ones forcing the hospitals and the doctors' offices to deal with them.
Right.
And so you're right. I mean, the whole notion that we're going to lose jobs is false. We did a study in 2009 that showed if you just put people in existing Medicare, don't restructure it as we want because we need to improve it, not just expand it, but just put everyone in Medicare, net 2.6 million jobs.
Yeah.
After you account for the loss in the insurance industry, we're going to shift from administrators to clinicians. Isn't that a good thing?
Exactly. To caregivers.
Exactly. From industry to caregiving. Exactly.
And imagine if, every doctor's office didn't have, 5 jobs. They're literally just to argue with the insurers, right?
The 300 people they have to deal with each month. In Canada, for example, Medicare for All is like Canada in some respect, many fundamental respects. The doctor's offices get paid once a month or twice a month.
Wow.
And they get
that's it.
And that's it. That's all the billing they do.
So what else are you working on? Are we as a movement, should we be focused on? Because you aim, here's the North Star, you're working on the California single payer.
That's right.
Working on federal single payer at the same time.
That's right.
We also have to take on the big pharma, just directly take them on. We need to do all of this as we march towards Medicare for everybody, single payer healthcare in this country. What other fights are happening right now?
Well, the key fight is obviously in California, around SB 562, because that is a state like Medicare for All program. That if we can do it in the biggest state in the country, we can obviously do it in the rest of the country. And the fact that other economies of comparable size to California have done it suggests we can do it in California. So that really is a key fight. But I think also, though, we've got to broaden the fight just from our nurses' perspective beyond just healthcare. Because when you talk about healthcare, you're talking about justice. You're talking about equality. You're talking about the fundamentals of our society that need correction. So, for example, you got the Nobel laureate Angus Deaton saying healthcare is the biggest driver of inequality. He's a mainstream economist. So we want to tackle inequality in all of its aspects. That means the Robin Hood tax on Wall Street, because Wall Street is the driver of inequality along with healthcare. But healthcare is actually part of finance. They build the hospitals, they dividends from pharma. The insurers are obviously part of the insurance finance complex. So all of that means taking on Wall Street means taking on those industries that are driving inequality and injustice. And what the Robin Hood tax would do, sponsored by Keith Ellison and Senator Sanders, would generate $320 billion a year for human needs programs. That's how you fund Medicare for All. But not just fund it, you change social priorities. You change the concept of what a society and government can do for people. Because ultimately, that's what we're fighting. We're fighting on when the Republicans do a health care bill, it just turns into a tax reform bill.
Right.
We're fighting that government is the problem. And so what we have to do, and healthcare is, again, a great entree to this, no, we're all in this together. And nurses don't discriminate. They don't discriminate when their patients appear. And that principle should govern not only healthcare, but society. So the fights we want to take on are precisely those. Where are those things that we can fight for, like a Robin Hood tax, like Medicare for All, like increased patient safety in the hospitals, but also then what does that say about the broader movement, right, that we're building on? And we say also that when you look at healthcare and compare the U.S. to other countries, the disparities based on race come to the fore as the large explanation for why people live shorter lives in America than the rest of the industrialized world who have national health care.
We're going to keep this conversation with Michael Lighty going right after this.